Fatigue may have set in, and some are already complaining about getting house color, but we must remain resolute in this fight against COVID-19. The vaccine is here and more are coming, which means the end of the pandemic is in sight. Hi there, this is Jamaica Magazine and I'm Adrian Atkinson, encouraging you to follow the protocols. Wash hands, sanitize, maintain your distance and mask up. Stay with us. We have lots more in store just for you.
Agriculture and fisheries is big business. Get formalized this year. Be among 100 farmers and fisheries producers who will benefit from a developmental project funded by the International Labour Organization and implemented by the Government of Jamaica. Whether you're male or female, we want to help you. Young farmers, there's a special place for you too. Apply at any RADA or JBDC office island-wide and jbdc.net. Deadline March 22. Agriculture and fisheries is big business.
Good day, I'm Lorraine Mendez and this is your JIS News for Tuesday, March 16. Jamaica is the first country in the Caribbean to receive COVID-19 vaccines through the COVAX facility. On Monday, 14,400 doses of the AstraZeneca vaccines arrived on the island. This follows on the heels of last week's delivery of 50,000 doses, a gift from India.
With these additional doses, Jamaica will continue to administer vaccines to the priority groups as outlined in the vaccine plan.
The priority groups include healthcare workers, members of the Jamaica Defence and Constabulary Forces, as well as persons 60 years and older.
This delivery is part of the first phase of deliveries for Jamaica, and more vaccines are expected to arrive successively during 2021. According to the first round of COVAX allocations, Jamaica is expected to continue receiving doses through May, until it reaches 124,800 doses, the amount specified by COVAX.
Every dose arriving in Jamaica brings the promise of protection for many more families from COVID-19 infection. Over time, this will bring the pandemic to an end and reduce its harmful secondary impact on children.
The COVAX facility is a global effort between the Coalition for Epidemic Preparedness Innovations, Gavi, the Vaccine Alliance, UNICEF, the Pan American Health Organization, and the World Health Organization. COVAX seeks to provide vaccines for at least 20% of the population in each participating country in 2021. Occupants of infirmaries and nursing homes, as well as those who administer care in these institutions, have been added to the priority list for vaccination. Persons in this group will start receiving doses of the vaccine this week.
A lot of our vulnerables and very vulnerable persons reside in our infirmaries, whether private or public. They are the ones with significant comorbidities, who are older, 60 and over. And indeed, if you look at the history of our infirmaries in other jurisdictions, we've been lucky here. Not just luck, we've worked at it. The truth is, a lot of deaths have taken place in infirmaries throughout the world once the virus touches down in those institutions. The spread is fast and the impact is devastating.
Health and Wellness Minister Dr. Christopher Tufton says vaccines will be administered to parliamentarians who are 60 and older this week. Uniformed groups, including those stationed at sea and airports, will also be inoculated in the weeks to come. 12,099 persons, or 71% of the targeted priority group, have already received their first dose of vaccines. The vaccines were administered between March 10 and 14. Still on health, Portfolio Minister Dr. Christopher Tufton says contingency plans are in place to administer COVID-19 vaccines to persons in the priority group who are not healthcare workers or members of the security forces. Minister Tufton shared that persons in the 60 age group and older are given doses to prevent wastage. This, as once opened, the vial, which contains 10 doses of the vaccine, has to be used within 6 hours.
The plan does cater to persons who are at home and not mobile because of age or restriction. And where we have to go to persons who need a vaccine, we will do that because the plan does have a mobile component.
Dr. Tufton was addressing the weekly virtual COVID Conversations press briefing on March 11. Dr. Tufton said the process of registration and appointment for some 350,000 persons 60 years and older to receive the coronavirus COVID-19 vaccine will be facilitated through the ministry's 888 One Love toll-free number, as well as its website, among other means. In other news, Cabinet has approved the transfer of the portfolio of the Micro-Investment Development Agency MIDA to the National Export-Import-Exim Bank. The MIDA portfolio will be managed as a concessionary revolving loan program for productive micro-enterprises.
In recent years, MIDA had increased its lending to the micro-productive sector due to the positive spin-off from supporting value-added enterprises. Several steps were taken towards winding up the MIDA in keeping with previous decisions of Cabinet to modernize and streamline public bodies.
The agency's functional mandate as single staff member and fixed assets of the entity will be transferred and managed by the Ministry of Industry, Investment and Commerce in keeping with standard asset management practices. And finally, the Registrar General's Department is reporting that it has maintained its 98% registration of births at hospitals and birthing centres across the island. Chief Executive Officer Charlton McFarlane says this is as a result of the introduction of new bedside registration protocols since the onset of the COVID-19 pandemic. Mr. McFarlane says the protocols include making changes to the collection of birthing information by RGD officers located at hospitals and birthing centres. This, he says, was communicated to the CEOs of hospitals and the Ministry of Health and Wellness,
to ensure that the new protocols are facilitated as best as possible. In particular, for mothers who are COVID positive, but are also giving birth at the same time, clearly those mothers would be isolated in specific sections of the hospitals. What we use in those cases is what we call the notification of birth, which is information that is placed in the hospital logbook and then that moves over to our registration officers. So it removes the need for our registration officers to come in contact with mothers who are directly impacted by COVID-19.
And that's it for JIS News today. I'm Lorraine Mendez. Thanks for watching.
The Forestry Department is leading the implementation of the National Tree Planting Initiative, which seeks to plant 3 million trees in 3 years, one for each Jamaican plus a little extra for good measure. So I'm inviting each Jamaican to visit our nurseries across the island and collect your tree seedling and make your mark towards this great goal for Jamaica.
Up next, Prime Minister Andrew Holness on the ground balancing the books while keeping the nation safe. Watch this.
Jamaica receives first batch of COVID-19 vaccines. Enforcement measures to be ramped up, and government prioritizes women on International Women's Day. You're watching Jamaica House Weekly. I'm Vaughn Davis.
This is a very important moment for Jamaica, and indeed it is my great honor to express the gratitude of the people of Jamaica to the people of India and to Prime Minister.
Prime Minister Andrew Holness as Jamaica received its first batch of COVID-19 vaccines on March 8. The 50,000 AstraZeneca vaccines are a gift from the government of India. The island also received its first 14,400 doses of vaccine under the COVAX facility on March 11. Another 1.8 million doses are to be supplied to Jamaica starting in April under the African Medical Supply Platform. This in keeping with the government's plan to secure vaccines for some 2 million Jamaicans. Last Monday, government revealed plans to begin the rollout of its COVID-19 vaccination program on Wednesday. 3,280 doses were administered to healthcare workers on March 10. It's expected that 47,000 doses will be distributed over the next 3 weeks to healthcare workers, members of the Jamaica Defense and Constabulary Forces, as well as persons in the 60 and older age group. By May this year, the government anticipates that the country will be in receipt of a total of 974,800 vaccines. The overall procurement is approximately 4 million doses, and Prime Minister Andrew Holness says the budgetary allocation has been made.
I want to assure the nation, your government is acting with the highest level of responsibility in this regard. Before we take on any vaccine, we have to be sure of its safety and efficacy. We are all free people in Jamaica. Freedom is paramount. Freedom is the ultimate. Freedom is the Jamaican dream. However, we are not free to be irresponsible. With great freedom comes great responsibility. And as a citizen of this country, you have a responsibility, more than enforcement, more than compulsion, but a duty to follow the law.
Prime Minister Holness to Jamaicans Monday night as the island continues to see an increase in its COVID-19 infection and mortality rates. Most of the ICU beds at the island's hospital are at capacity. Mr. Holness says the government remains resolute in its COVID-19 containment measures. As such, persons were warned that tighter measures would be introduced if the positivity rates continue to rise.
These measures will have an impact on the economy. It will have even greater impact on your ability to move. It will have even greater impact on your ability to gather. It really depends on what you do at this point in time.
In the meantime, persons who disobey the COVID-19 containment measures stipulated in the Disaster Risk Management Act will soon be ticketed. Prime Minister Andrew Holness says work is far advanced to have the legislation introduced as part of measures to step up enforcement.
The whole ticketing process is now at our legislative committee, which is the penultimate stage before it reaches Parliament. So we are on track, but there are other measures which will require legislation as well, which we are contemplating. Is not only against the individual not wearing a mask, which may prove difficult in certain circumstances, but really there needs to be greater enforcement against institutions, meaning, business places and other such places where persons gather to transact business or for social interaction.
Prime Minister Andrew Holness says his government continues to actively prioritize gender equality. He says this is seen in the tangible steps to recruit and promote women, recognizing that women have been innovators and leaders in all areas of national life. Mr. Holness also pointed to the record number of women who are now serving in Parliament. The Prime Minister's comments on International Women's Day are contained in his address for Commonwealth Day. Delivering a common future, connecting innovation and transforming is the theme for this year's Commonwealth Day observation. Mr. Holness affirmed Jamaica's commitment to the 54-member body through the shared goals and core values of democracy, human rights, and the rule of law. He said Jamaica continues to play its part in raising awareness to shared issues such as climate change and environmental protection. This is evidenced by the National Tree Planting Campaign, a ban on single-use plastics, as well as the streamlining of development ambitions to meet environmental targets. And that's it for Jamaica House Weekly. Be sure to join us next time for the news stories coming out of the office of the Prime Minister.
The numbers keep climbing, and yet some of you are still complaining about curfew times. Is that being selfish, or are you being smart? You continue to blame the government, stating they are not doing enough. But the big question is, are you doing your part to help decrease the spread? The unfortunate reality is that far too many people refuse to take the coronavirus pandemic seriously until they or someone they love gets infected. Now, this is what we do not want, and I don't believe I can stress this enough. Wear your mask, sanitize. Of course, we love to hug and socialize, but just ease off some of that right now. Not just for your safety, but also for others. It look hard for your relatives to be home doing all they need to in order not to catch the virus, and you out on the road being reckless and carrying it right home to them. Each one of us needs to help during this fight against COVID-19 as we work to make Jamaica the place of choice to live, work, raise families, and do business in a healthy environment.
The Ministry of Local Government and Rural Development has big plans for the upcoming financial year. More resources for fire services and the National Solid Waste Management Authority are among the slew of benefits to come. Take a look.
When we speak about the role of local government, let me again remind those persons who feel that there's no need for local government, that 85% of the country's survival is vested in local government. 85%. We clean garbage. We fix parochial roads. We run markets. We run abattoir. We deal with building planning. We deal with hairdressers and barbers.
Government has signaled its intent to spend $830.8 billion in the 2021-2022 financial year. Of that amount, over $16 billion has been granted to the Ministry of Local Government and Rural Development. Under recurrent or housekeeping matters, the ministry will seek to improve the affairs of the general public services, economic affairs, environmental protection and conservation, housing and community amenities, and social security and welfare services. Rural electrification works will be supported by a $311 million allocation to the newly established Energy Solution Division. $100 million is allotted for parochial road development by the municipal councils.
The National Solid Waste Management Authority, Mr. Speaker, continue to be a positive example of government in action.
$2.6 billion is earmarked to carry out several solid waste management projects, including public cleansing and garbage disposal. The provision of community and social services will also be strengthened with a subvention of over $1 billion. Major activities under this project are to be carried out by the Social Development Commission. $7.5 billion is set aside for national disaster management. This includes the Disaster Preparedness, Mitigation and Response Project managed by the Office of Disaster Preparedness and Emergency Management. Repairs to fire stations, restoration of fire hydrants, and rehabilitation of fire vehicles are also accounted for.
We are a coastal country. All our important organizations sit next to the ocean. Our parliament, our bank, our courts, our two major international airports, our oil refinery. We therefore have to take disaster seriously.
Continued care will be extended to the nation's homeless and most vulnerable.
In the corporate area, there are more than 2,000 Jamaicans who are living on the streets. We call them the homeless population. And the corporate area represents almost 70% of that number.
$1.8 billion has been set aside to support these individuals, managed by the Board of Supervision. Of the $2.3 billion in the capital budget, the ministry will be executing two major projects. $1.9 billion will be spent to complete acquisition of 30 fire pumps to increase the Jamaica Fire Brigade's capacity for adequately responding to emergencies.
It is of importance that when we ask the men and women of the Jamaica Fire Brigade to put their lives on the line, that we do so by providing the necessary equipment to make them perform their duties.
$375 million is tabled for the improvement of emergency communication system in the country. The project is being implemented by the Office of Disaster Preparedness and Emergency Management. In the upcoming fiscal year, it will seek to construct new repeater huts and maintenance centers in Kingston and St. James, install communication equipment, and repair access roads to communication tower sites, among other activities. The project is jointly financed by the Jamaican government and the Japan International Cooperation Agency. The Ministry of Local Government and Rural Development in 2021-2022, seeking to fully safeguard lives and properties, practice effective solid waste management, increase community participation, and implement rural electrification and house wiring, among other things.
Informing.
Jamaica today confirmed its first imported case of coronavirus.
Educating.
If you follow the recommended procedures, it is highly likely that you will not get the disease.
Going beyond to keep you informed and connected.
Welcome to Get the Fact.
Even through the pandemic. Helping you stay safe while we protect ourselves. Dependable. Impactful. Accurate.
This is your JIS News.
Credible. Trustworthy. Every day, everywhere. Serving our customers proudly.
As the country manages COVID-19, it is best to consider all groups to ensure equity and equality. The government, in partnership with a private financial institution, has provided insurance benefits for farmers and fisher folk. Listen on for more.
Our farmers and fisher folks are the backbone of our country. It is they, our food heroes, who toil daily to put food on our table and ensure that our economy continues to move forward even in the face of a global pandemic.
This recognition of farmers and fisher folks' critical contributions has materialized into a program that seeks to ensure they are empowered and protected as they go about feeding the nation. Effective March 1, 2021, farmers and fisher folk, along with their dependents, will have access to health and life insurance under the Sagicor AgriCare program. Registered farmers and fisher folk will benefit from a group major medical plan, a full house plan, a critical illness plan, a personal accident plan, and a group life insurance plan.
This is a private sector initiative which is being facilitated by the Ministry of Agriculture and Fisheries. It is Sagicor that has crafted these benefits and premium packages, while the government of Jamaica, through the offices of RADA and the National Fisheries Authority, will assist in the sensitization and the enrollment. Under the group major medical plan, farmers and fishers can have access to coverage for usual surgery and hospitalization, and coverage for things like chemotherapy, radiation, and dialysis. Under the full house plan, farmers and fishers will have access to a bundle of money that can be utilized to purchase certain primary care benefits, drugs, dental, and vision, doctor visits, and consultation.
The Sagicor AgriCare program also covers farmers and fishers who get diagnosed with certain critical illnesses, suffer an accident, or unfortunately die.
and programs have been crafted in a way that are affordable and manageable, whereas Sagicor will facilitate premium payments either 4 equal quarterly payments or twice per year.
For a monthly premium of $217, farmers and fisherfolk can access $1 million under the Personal Accident Plan. The Critical Illness Plan has a coverage of $500,000 with a monthly premium of $284.10. The Group Life Insurance Plan will give coverage of $1 million for paying just $965.95 for their monthly premium. For the first 3 months of the program, interested farmers and fisherfolk can sign up without a doctor's referral form.
This health and life insurance plan is a significant step in the transformation of our agriculture and fisheries sector. Not only are we securing the health and well-being of our farmers and fisherfolk, but we are sending a clear signal to all of Jamaica that farming and fishing are valid professions. This is especially important to our youth. We want our youth to know that farming and fishing are not only important, but are lucrative and well-secured professions.
My job is to ensure that every man, woman and child maintain good health at all times.
Our primary function is to ensure that government services are delivered effectively and efficiently.
We are building forward
together.
You've reached the final page of the magazine. Thanks so much for staying with us. Another one unfolds tomorrow, so come back same time on this station. Until then, click on our website and YouTube channel for more informative features. While there, please subscribe to our pages and click that notification bell so you can stay in the know. And don't forget to reach out to us on social media. I'm Adrian Atkinson, encouraging you to think positive as you stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.